Many times patients will be diagnosed as hypertension or diabetes or TB, and they will be given medicine, but they don't know about their disease condition as well as the needs of continuing treatment management as well as their diet and how to manage their life. Education room, we used to conduct health education based on the needs of the patient. So usually Friday is our diabetic clinic, and we have more patients in diabetic clinic. We have more than 4,000 patients right now, and we used to call them on Friday based on their sugar control, and we can look after 30 patients every diabetic clinic every Friday. And on other days we used to give education on TB patients. Once they start their medications, we give education on TB, as well as we also give education on renal replacement therapy, those who are in end-stage kidney diseases, as well as we used to give education related to those who are having hyperuric acid. We used to give diet education. Hypertension, we used to give DASH diet, that is dietary approach to stop hypertension. And then we also give education related to renal diet, those who are having end-stage renal disease. And moreover, we give CAPD education to those who develop kidney failure. They will come for renal replacement therapy education, and as well as once they decided to do peritoneal dialysis, we give continuous peritoneal dialysis education, and we give training to the family members for the caregivers.
We have a program known as the Clhtc, the Community Lay Leaders Health Training Course, which is a distance education program from CMC Vellore, and it aims to train, lay leaders. Because India is such a vast country and doctors are very high commercial value, so most of them are not going to go to the peripheries, and a lot of trained medical people don't go there. So instead of sending people there, we get people from the peripheries, train them so that they can go back and be effective as health workers in their area.
The aim of this Cihsr program is to equip the missionaries with basic skills and knowledge for primary health care, because there are lots of dedicated missionaries working in rural areas where they need to take care of many people, because there is no doctors and nurses nearby where they live. So after taking this training, they are able to give first aid, and they can identify the diseases like diabetes, hypertension, and they are able to give health education related to that, as well as they can refer the cases before it becomes very serious. Recently we have visited some missionaries in Burma who took training from here, and they were serving in Burma. So with the training, they were able to give first aid, and they also conduct primary health care training to the communities, and they have trained already 18 local people out there in simple language. I will be sharing only 2 testimonies which they were able to perform and which encouraged us a lot. There was one lady who was more than 100 years old who got a big injury over her neck because of her fall, and then there was lots of bleeding, and they were not able to take care of her because there was no nearby hospital, there was no doctors and nurses. And with her needle and thread from her pocket, she was able to give 5 stitches with shivering, and she could able to perform well. And now the stitch is dry without any complication, and she is alive. And in that case, they will not be able to take her to anywhere, because by bike only they have to transfer the patient. And another testimony was our missionaries. She was supposed to do a survey for a camp, and when she visited, she found a girl who was 12 years old with rotten bone over her leg, and she could identify her and could inform her organization, and they will organize to arrange one chopper to bring her to Tunsan, so they could do surgery from Tunsan, and she could recover now, and she's able to perform herself, to take care of herself right now in Tunsan.